all get our regular checkups done, keeping in mind preventive healthcare and with full know-how on why catching problems earlier will help us better. But now, we can also predict how healthy we would be in years to come. This is possible using artificial intelligence to predict how healthy we would be in the near future. Predictive health analysis is a growing market in India and outside. Just look at the figures. It's projected to reach 156.36 billion by 2034 from 22.49 billion in 2025. A staggering CAGR of over 24%. So what's driving this?
AI is fast becoming an indispensable tool for doctors, not just in specialty care, but also in routine checkups. The new paradigm shift that it is bringing is around early detection. It is able to find signs of diseases even when the symptoms of those disease have not become apparent for the patient. And when you can detect early, you can treat early, and you can actually save lives.
Take the example of sepsis, a life-threatening condition that kills millions every single year due to late detection. Traditional methods often fail to catch early signs, but AI models like Composer are changing that. Conformal multidimensional prediction of sepsis risk, or Composer, is a deep learning tool analyzed ICU patient data and predicted sepsis onset hours before symptoms appeared. In a major clinical trial involving over 6,000 patients, it achieved a 17% reduction in mortality. The AI examined variables like vital signs, lab results, and comorbidities in real time, giving doctors a critical head start. Predictive AI is also making strides in maternal and child health. In partnership with Google DeepMind, non-profit Arman improved retention in prenatal voice messaging programs. Their AI model predicted which mothers were at risk of dropping out, leading to a 30% improvement in program engagement. In the government-led Kilkari initiative, AI optimized call times, improved message pickup rates by up to 12%. From urban hospitals to rural health workers, AI-driven predictive analytics is making healthcare smarter, faster, and more inclusive. And as India continues to adopt and innovate in this space, it's not just about treating illness, but preventing it before it starts. AI-supported mammography is revolutionizing early breast cancer detection, improving accuracy and efficiency. Studies show that AI-assisted screening detects up to 29% more cancers without increasing recall rates.
In a normal mammography, it's a little bit painful for any woman to get that test done, but the technology, the machine which we are using, it's almost painless. And then with our AI-based technology, we are able to detect any abnormalities 2 years before it can be done by a normal scan. And we are using 3D digital mammography, which is a very advanced technology. So we always encourage that, since it is a almost painless process and it can help any woman to get rid of these diseases at the early stage.
Predictive analytics works on historical data, compares the patient's test results with an entire database of similar reports, research, and parameters. Hence, there are data privacy concerns.
So there are broadly 4 points that I would say when it comes to patient privacy and how to actually uphold them. The first one would be de-identify the data. So that means, suppose we're using a patient's data after we get their consent, it has to be omitted, or the unique identifiers have to be omitted. So the name, the gender, other details of the patient, all these should not be visible in the data that is fed in. The second one would be to encrypt the data. So encryption basically means that you scramble the data in a way that it becomes a code that only particular users can actually interpret. The next one would again be transparency. So your privacy policy for patients should be very transparent. It should show the patient exactly the data that you're using and how you use it. And the next and the most important is that the data belongs to the patients. So patient control. Patients should be able to edit the data, should also be allowed to delete the data at a later point of time that they would want.
Predictive health empowers proactive care by using data to anticipate and prevent illness before it actually occurs. It improves outcomes and reduces costs.